acutely aware of recognizing the signs. Like Robert has taught me and probably has saved my own kids' lives. Wow. By the signals. Like, yeah, I was there for him, but the education he gave me, I think, saved my son and daughter, to be honest, because I would never have recognized those signs because I didn't know about those signs prior to what happened to Kennedy. I just, when we were growing up, Robert and I, when we felt depressed, our parents would just kind of hit us up the side of our head and say, get tough. Right. And that would be it. And I'd be like, all right, I guess I got to get tough.
I made it through the rough time. I made it through the tough time. I made it through the bad time. So now I gotta get mine. Gotta weather the storm. Gotta get mine. Gotta weather the storm. I gotta get mine. Gotta weather the storm. Okay. One day we gon' get on. Talk to 'em. You ain't got a choice.
Welcome to Bailey and Buck Unplugged, where we talk about sports, entertainment, and mental health in support of the Kennedy Kids Foundation. If you're struggling with mental health, we encourage you to speak up and get help. A great place to start is 988. That's the free crisis prevention lifeline. Or you can check out the resources tab at kennedykids.org. If you are in an absolute emergency, please dial 911. Either way, we want you to know that you are not alone and that you don't have to struggle, and speak up, get help. There are resources available to you, and we are here to support you. If you're new around here, I want to introduce you to our host. I am Misty Buck. I am an author and a mental health and performance coach. And my co-hosts are Robert Bailey. He is the president of Rosenhaus Sports, the president of Kennedy Kids Foundation. He's a two-time Super Bowl champion, two-time college national champion. He's an NFL record holder, and he's an ESPY winner. And we are also joined by Bailey Buck Mashburn. She is a celebrity wedding and event planner, a former NFL cheerleader, and the executive director of the Kennedy Kids Foundation.
Hi, and welcome to another episode of Bailey and Buck Unplugged, where we are very honored to welcome the esteemed Dr. Stephen Schnur. He is the Chief Executive Officer of Lynx Advisory and Lynx Medical. He's also a board-certified internist and cardiologist. But more important, we're super grateful to have his team and Lynx Advisory and Lynx Medical as proud supporters of the Kennedy Kids Foundation. They represent the highest standards in concierge healthcare, advanced diagnostics, and advocacy. And most importantly, they share our mission of prevention, access, support for teens and families. And it's a really awesome partnership that we have with him. And we can't wait to talk about all of the things that he's doing in the mental health space and to support others, because, together we're working to break down barriers, providing hope, care, and resources to prevent teen suicide, which is our mission. So, Dr. Schnur, welcome to the show.
Thanks for having me.
It's great to have you, Steve.
I like the clapping.
Yeah.
A lot of clapping.
I like the clapping, Steve.
Clapping is good.
Steve, a lot of people don't know, obviously cardiologist. Steve's one of my best friends, and Steve over the years has been instrumental in a lot of things in my life. One of the most important was he was there for me when we lost Kennedy, and he's been there for me ever since. He was the first one to help me start the Kennedy Kids Foundation. He helped with the structure of the foundation and gave me the right people to get this started. So we wouldn't be on our podcast now. We wouldn't be where we are helping the community if it really wasn't for Steve. That was during a very trying time, to say the least, and he came through. So I want to give him a lot of credit. Steve, I love you, man. You're the best. But not only with me, because obviously we're extremely close, but just recently, Steve saved someone's life on a plane that went into cardiac arrest. And Steve, tell us a little bit about how that was, that like the pressure around having on a plane having someone, you know, go into an emergency situation. How was that for you, man?
I mean, it's interesting in that I was on a plane from Miami to New York to actually go there and spend time with, family members that have had, mental health issues, to be honest, and to support them over the weekend and take them to the US Open and kind of be there, for them. Um, and it was kind of what we call like a semi-private plane, which had about 30 people on it. And they came up to me and asked if I was a doctor. And there was a woman in the back that they said was sick. But when I went back to see her, she was in a seat where she was pulseless and not breathing.
Wow.
And so at that point, I had worked ERs 20, some odd years ago, but you don't forget, you just don't forget. And so for me, there was a retired nurse on board, thank God, and there was just a regular civilian. So we had to lay her down, raise her legs, start CPR. They do have a like mini crash cart on board, but it's not sufficient. But we used what we had to start an IV, give medications. Thankfully, her pulse started to come back. It was about 30 minutes that I had to run this code, but I've done it before, but not for some time. So at the end of the day, um, they had to land the plane emergently, and so they had landed in North Carolina. Fire rescue came on board. I spoke with them,
Wow.
and they wound up transporting her to the nearest hospital where I didn't know what the outcome was. And 3 days later, I flew back to Miami from New York, and her husband was on board. And so I found out that she did survive and she's in Miami. He was obviously very grateful. And they came to the office last Thursday. They became, members of our company, and
Oh, wow.
they joined as Lynx members, but we took pictures and, a lot of hugs and kisses. And, the bottom line to Lynx and the message that we have, and I was explaining it to someone at lunch today, is that, the passion to save someone's life, the ability to have a company that, in my mind, the purpose there is to save people, whether it is to save them from cancer, or to screen them for Parkinson's or dementia, or to recognize, teens. And I don't, you want to know something? Not really just teens, but you have teens, you have the millennials, you have everybody that have mental health issues. And so we have a very strong mental health focus on our board. And we do have like an expert on our board that deals with this.
Right.
And he's probably the most we refer to him more than I refer to probably anybody else on the board, which shows me that I would say close to 70% of our members do have some mental health issues that need to be addressed. So you'd be surprised at the percent of people that need help in that arena. And I'm acutely aware of recognizing the signs. Like Robert has taught me and probably has saved my own kids' lives.
Wow.
By the signals. Like, yeah, I was there for him, but the education he gave me, I think, saved my son and daughter, to be honest, because I would never have recognized those signs because I didn't know about those signs prior to
Right.
what happened to Kennedy. I just, when we were growing up, Robert and I, when we felt depressed, our parents would just kind of hit us up the side of our head and say, get tough.
Right.
Right.
And that would be it. And I'd be like, all right, I guess I got to get tough. We didn't
Yeah.
recognize it, right? We didn't know that. We didn't grow up with that. So we didn't know that, you don't do that stuff, So I think that while Lynx supports Kennedy Kids, I think Kennedy Kids supports Lynx. And that's what I like
Right.
about it. Yeah.
One thing I want to, Steve, I appreciate you for sharing that. I thought about, hey, giving you the opportunity, but didn't want to pry, right? Everybody's got their family, and certainly, issues in my family, not just Kennedy, but, you know, just from the situation that happened, we had people in my family that had to get therapy and go through the whole process. And for you, Steve, as a doctor, you're a celebrity doctor as well. You deal with a lot of celebrities. You deal with your family. You got your kids. You got your work. You build businesses. You've sold businesses. One thing I want to talk about is just you personally, and how is your mental health? What can you think of a time back in your life that maybe you went through a tough time mentally, and how did you get out of that?
It's an interesting question because, as I've built, many successful businesses that have, let's say, made me financially stable, right?
Right,
But
right,
I learned through that that's just not enough, right? That's just not enough. And after a while, it becomes I hate to say meaningless, but does become meaningless. So I've had times in my life, obviously, with my kids especially, where sometimes even to yourself, you're like, you get super depressed over it, right?
right,
Um, and you get times where you think about, what's life about? You really get down on it, right?
yeah,
But, when you have a good support structure around you, you got good friends and good family that pull you up and are there for you, it kind of helps you get through those times. Because I always have I have this attitude where, that when things get really tough, like mentally, to like just not let it beat me, and to try
right.
like push through it.
How do
Uh,
you push through it? Sports,
So yeah, my technique of pushing through things, I think I like you, I rely heavily on sports and activities, right? So I
yeah,
know,
exercise,
yeah, I know that for me, exercise is a huge endorphin happiness push, right? So I know if I wake up in the morning and I do an exercise that I like or something that is, extremely active, I know that it bathes my brain with endorphins and it allows
right,
me to get through the day being really happy. And during that day, there's a lot of bumps in the road, right? And there are a lot of things that can make you unhappy. But I do think, you know, exercise, self-care, for me, meditation I don't do, but you know what I do? I do all the, massage therapy and I do all that self-care stuff with,
you get your pedicure, manicure, and all that.
yeah, I mean, all that stuff, makes me feel good, right? And then I surround myself with positive people. So I try and keep a very tight network of people that are positive. I don't surround myself with the glasses half empty people.
Right,
So I think surrounding yourself with like-minded people makes a big difference. So I think it's a combination of factors that make you get through times where you think it's, really, really, tough. And so to me, and having sounding boards, right, to talk to people. So I think that makes a big difference, and that's how I cope. That's my coping mechanism.
yeah. You got to get the exercise. You got to get the sports in, the paddle, the
You know,
pickle.
the other thing that makes me happy, by the way, with all the success I've had financially, is doing things for other people, right?
Right,
Like supporting Kennedy kids, supporting paddle players, supporting, like tonight, you're supporting the same organization that deals with, like, think teens or children with neurodivergent
Yeah,
medical conditions,
I'll
right?
be there. I'll be
Yeah.
there.
So doing things, I get such happiness out of giving money to good causes or supporting people that are, let's say, less fortunate, than I am, rather than me, buying something for myself. Yeah, I like buying something for myself, but I get more satisfaction at doing something nice for other people.
Right.
Yeah.
You know, being a doctor, Steve, you've been a doctor for how long now?
Let's say 25 to 40 years. Yeah.
Wow. So you've been a doctor for a very long time.
Yes.
What do you attribute the rise, this incredible rise of suicides among our community, and not just in Florida, but everywhere? What do you attribute? Because you've seen a lot of people, all the illnesses that happen.
All right.
It's under your roof, it's under my roof, it's under everyone's roof. I firmly believe everyone at some point in their life has had trauma. What do you think the rise in suicide, though, that has come across this country? What do you think it's from, since you're in the field, the medical field? Your
I
thoughts?
mean, yeah, I mean, I think you and I agree that social media
Yeah,
has destroyed, teens and millennials. You're seeing, whereas, just look at what happened recently to, the right wing, Charlie, I forgot,
Charlie Kirk.
yeah. You're seeing it on TikTok, like you're seeing that violence. Whereas when we were young,
You wouldn't even see it.
you may get a mention in a newspaper and on TV. Oh, this person was
You certainly won't see the act itself.
right. And seeing the act itself, and then seeing all the hate that
Yeah,
is generated from it on
yeah,
all it what it does is, it takes these teens and these millennials and it creates, you know,
yeah.
these
The
issues,
narrative.
whether the narratives are whether A, they get violent, B, they get so depressed they want to commit suicide because they think the world is a bad place. So I think the fact that when we grew up, there was 5 television channels and there was no phones, right? You could you
Right.
can you can dial it, but you basically had your small niche of friends and 5 channels.
100, and that's it, and that's all you had to deal with mentally was
Right,
your 5 friends and the few shows you watched on TV. Now, right? So hypothetically speaking, let's say we took in, maybe 100 pieces of new information a day from
right,
between our 5 friends and 5 channels.
right,
Now these kids are taking in hundreds of thousands of information per day, and they are in their teens. So, and some of them are younger than their teens.
right.
And so,
And right, and not only that, but they don't need even to leave their house
right,
anymore to
to get
gather.
that information.
They can sit in a room,
Dark room.
isolate themselves, take in millions of bits of information, um, and
And then
really,
process it, and no one's taught them how to process it.
right. And if they are depressed and they're even considering, let's say, suicide, they can easily go on TikTok or ChatGPT or AI or Google or
and
whatever
learn what to do.
and learn the best way to do it. In other words, like and they can probably reach out to TikTok and talk to kids that are ready to do it. And as a collective group, they can do it. I mean, it's insane, the information stream of what you can do. And so, that's an issue. I think that, divorce rates, I think, are pretty significant, right? So a lot of kids are growing up in separate families, and a lot of convolutions going on there, and then identities and the you know, all this, trans and gay and all, there's a lot going on that is very confusing to kids growing up. Let's put it that way.
Do you think the social media platforms have a responsibility? What's your thought
I mean, I
on the
mean, look,
source?
they have a responsibility, but I don't think they really care. Do you
Right.
think? I think that they're there to make money. I mean, I think it is what it is. And I also think our political arena for the last, I don't know, 4, 8, 12, 16 years has been so divisive that hasn't helped us either.
It's just crazy how these social media companies have taken it upon themselves to help their families, but really hasn't done enough to help, with all the suicides and all the depression that social media is causing. But just to move on, when it comes to what our goal is as a foundation, it's really about awareness. Steve, because of everything that's happened, have you made it, made it one of your important topics to talk to your kids about mental health? Do you talk to them at the table? How do you discuss it, like, with your daughter, your young daughter? How do you talk about mental health? What are the things that you guys do um, to discuss it with your kids?
I mean, one is they knew Kennedy, right? And so
Yeah,
for them, this was obviously super impactful. So
yeah,
yeah, so for them, it's a little bit different in that, they know, you're like a second dad.
right.
You're like their mentor. So therefore, you're around them so much
They
that
know.
they're ingrained with it. Um, but when we get into discussions about it in general, you know, um, they have a pretty, they're pretty aware that where there's episodes where they're going to feel down, and there's episodes where things may not be going right, and we talk about it. I said, look, guys, most people live in a world on a scale of 1 to 10. People live in a world from a happiness to a sad at a 5. Some days it goes up to a 7, and some days it goes down to a 3. I go,
Right,
we just don't want it to go to a 10, and we just don't want it to go to a 1. But
right.
people live in that range of 3 to 7, and that's life, and that's how it's going to be. And I said to them that, the best thing that you guys have is you got a great support structure. I go, you got me, you got the family. I go, you got all my friends that love you guys. You got Robert and this one and that one. I go, you guys got a million people you can reach out when times get tough. I said to them, so, I just keep going over it. And then they see what goes on in the world and the violence in the world. And we talk about it, in other words, I try to explain that, it's better to be transparent and open and express your feelings, and,
Yeah,
don't look happy and be sad. If you're sad, tell us you're sad. Don't fake happiness. I go, the worst thing you can do is kind of fake it. So
that's a good point, Steve.
yeah, I go, because
Misty, what do you? I've never heard anyone come up with a scale, and his scale was right on. I agree with you, Steve. Your scale, 1 to 10, and if you don't be too high, don't be too low, and if you are, come talk
right,
to us.
yes.
It gives them a sense of understanding, having that scale theory that you created. Misty, have you ever heard of the scale? That's pretty good.
I use a scale actually daily to track my mood.
Oh wow,
Yeah, because I want to see, I just started doing this, but I want to kind of see, my progress, my average day to day. And it's funny that you say that average, I'm probably like a 7. even though it'll kind of change throughout the day, because I think that's like a normal thing that your emotions change. But if you're
I,
kind of looking
I,
at the days overall,
how do you use that scale, Misty? Like, do you write on it every hour?
it's
Tell
in
us a little bit
it's
about
in
it, because I'm sure
yeah.
people out there may want to follow
It's
follow
actually
that
it's
technique.
in the app that I developed. So one of the tools in there is to track your mood every single day, and then you can follow your progress chart to see kind of how that works. So that's how I use it.
Misty, tell us a little bit about your app.
Yeah, so it's called Zenleats. So you go to zenleats.com, so Zen Leats like athletes, Letes. And you sign up for it. It's completely free. But I developed it because I wanted to give people a tool, because you're talking about social media and how everyone's so much got all these tools in their pockets, right? And we're so used to doing that. It's become really second nature. What do you do when you get up in the morning? You check your phone, right? Which I'm kind of against, but anyways, it happens. So the point of this app is that you go in there and you set an intention for the day. Like, how do you want to show up? What's your mindset? Your affirmation of the day. You track your mood. There's meditations in there. So let's say you just need like a quick 60-second reset. There's something for that. If you're having trouble winding down before sleep, there's something for that. So for athletes, there's stuff in there to help with performance, getting over tough losses. Like, there's all kinds of things in there. But the point of it is to just provide this tool that where you can go in there and track your progress. You can see, what's my streak, how many days in a row have I done this. Let me look at my week. Let me see what my mood scale has been. So I think like that's so when you were going back to asking about the scale, I love that this is coming up, because like I just started using this myself. And it does actually help, because you're like, oh, okay, yesterday, maybe I was a 6, today I'm a 7. So that's pretty good, right? That's good, pretty good progress. And then
Right.
today, like, maybe I'm like more closer to like a 4 because I'm really nervous or whatever's going on in my life. But then that kind of bumps up as the day is going on. You can go in there and edit it if you want. But you can do that in something like the Zenleats app, or you can track it in a journal, or you can print out maybe like a worksheet, or you can just kind of keep it a note in your phone. It doesn't really matter how you do it, but I think it's important, to your point, Dr. Schnur, that we see, like, especially on the lower end, if there's too many days of those in the lower numbers in a row, now it's time to talk to somebody, right? Now
Right.
it's time to say, I need a little help. It's time to take that self-care, and whether it's something you can manage alone through exercise and self-care, and that's great. But even when that's not doing the job, when you're tracking those things on that scale, I think it's a really great point for you to be able to have that self-awareness to say, wait a minute, what is happening here? Instead of like you're going so many days in a row, right? So I find that really interesting. So how did you come up with that scale, Dr. Schnur?
Um, to be honest, I have these things where at 4 or 5 in the morning, I come up with all my ideas on all my businesses. So this is just something kind of came to me, and I use it with a lot of people, like Robert and I, a couple of days ago, we lost to two people that we shouldn't have lost to in Padel. And I looked at him and I said, right now you're a 1. Okay. Today, Rob is about a 6.5, but when I see him later tonight at the event, I'm going to push him up to a 9. I got
Good.
ideas, get him to the 9 level.
That's right. That's right. And that's what friends are for.
Yes.
As you were mentioning earlier, it's just supporting each other, family supporting each other. It's important to have the community around you that is willing to talk to you, is willing to be open with you, is willing to ask the question, how are you doing? Even though you may look happy, it's okay to ask, hey, how are you doing? So as you said earlier, a lot of people are smiling and faking it. No need to fake it, because you
Right.
can't get help if you're faking it. Communication in mental health space is so important.
Yeah.
And
I-
it starts with communication.
Yeah. People fake
Yeah,
it a lot. People fake,
yeah.
look, let's be honest, social media isn't real. I mean, for the most part, it's fake. And,
Yeah.
and that
It's
hurts.
a highlight reel,
It,
right? I
hurt,
mean,
it hurts people because what happens is, let's say your daughter is 15 or 16 and she goes on social media or Instagram and she sees all these beautiful people. They're really not beautiful. physically, but they look beautiful, and they may even be AI and not even real. And then she looks in the mirror and she says, wait a minute, I'm not pretty. And they get depressed thinking that the world of social media is the real world, where it's really just a movie. It's like watching a movie on TV. It's not real, but people
Right.
think it's real, and it's not real.
Right. And now with AI, you can even do more to the videos that you have. You can create stuff that's not even a real person, but it looks like a real person. You can make your face and your hair and your body and everything look perfect. And you can make people believe you're having the greatest time with the greatest relationship in the world, while other people who are watching may not be having such a great relationship. And so now it creates envy and depression. And it's just there are so many different topics that social media brings to the table, that people need to discuss, that really are hurting our community. And so, it's just one of those things, man, that there's some good to it, but there's a lot of bad. There's a lot of bad. But I want to get on to another, Doc, another thing that I've talked to people. We've had a psychologist on the show, and Dr. Crawford, and we were talking about the medication with mental health. What is your feeling on? Because some people are totally against it, some people are 100% for it. As a doctor and someone who is obviously in the field of mental health, how do you feel about um, prescribing medication to
Right.
to you know teens with mental health issues?
And Robert, real quickly, she's a psychiatrist, not a
Psychiatrist. I'm
She's
sorry.
a medical doctor. Yeah,
Psychiatrist.
so a little bit
So-
different. So
yes.
we'll get another doctor's opinion.
Yes.
Yeah.
Thanks,
So,
Misty. Go ahead, Dr. Schnur.
anyway, yeah, I think the bottom line, my feeling is that in the acute phases of a mental illness, I think that you're going to rely a little bit more on medication,
Right.
and you're going to involve a psychiatrist, psychologist, and obviously an infrastructure of family and friends, right? The
Right.
support. So what's so important is everyone being on the right page as a support structure, but yet in the acute phase of an illness, it takes a little while for a psychologist, family structure to really effectuate an acute change, right? So in the beginning, you're going to rely a little bit, it's a little bit more on medication. And then as you get over the acute phase, right, which could take maybe a couple weeks to a month to 2 months, then you get into more of a phase of where the actual counseling and the support structure are going to cause behavioral modification changes, and then you can start to slowly back off on certain medications as you continue to scale up the counseling. With that being said,
Right.
certain mental illnesses, right, that will require lifetime therapy, right? So if you're dealing with borderline personality disorders, you're dealing with bipolar disorders, you're dealing with, let's say, acute schizophrenia, things that definitely will need lifetime medication. In that case, yeah, you may be able to get them back on a lower dose of those medicines, but some of that medication is definitely going to be lifetime medicine, because they have documented, chemical imbalances that just doing psychological therapy, it's is not gonna work, right? So the bottom line is, every individual is different. Every mental illness is different. I mean, you could have someone that has trauma, in their family. Someone died, right? And so other family members may be depressed, but this is more of an acute depression versus a let's say what we call unipolar depression, right? So in that case, you may need acutely some medication and some psychological counseling, but over time, you're going to get them off all the medications, right?
Right.
And then, and then obviously, within that whole world, is lifestyle modification, dietary changes, exercise and fitness. And, so it is like, as I tell people about treating anything, look at mental illness like you look at diabetes, look at mental illness like you look at hypertension or any disease state. Look at it like it's a disease and
Right.
treat it like it's a disease. So let's say you're obese and you say to me, well, what do you think? Medication, or like diet, right? The answer is you may need medication acutely, right? Like some of the medicines like Ozempic, et cetera. And then you get them into a healthy lifestyle and stop the Ozempic, right? So I think mental illness is a disease. And I think you gotta treat it like the disease. Certain diseases like diabetes, you're gonna have it if it's insulin dependent, you're gonna need insulin for the rest of your life. You're bipolar,
Right.
you're gonna need medication for the rest of your life. That's just the way disease works.
I think, Steve, I think that was probably the most important uh few words that you said on the podcast. It's that treat is so important. Treat it like a disease. I can tell you that, when we had Kennedy and she was going through some of her depression, I never associated what she was going through with, as a disease. And I think for most people, that's why awareness is so important in communication. I think for most people, they never treat it like a disease. They treat it like our parents treated it, right? Go in the
Right.
room, go to bed, lay down, shut up, boy, get out of here, get tough, stop crying, do this, do that. And I think if you look at it and you say, hey, you know what? I'm looking at this from the standpoint of the disease angle, then now you're going to go look for treatment, right? And that treatment is going to be with a doctor, right? A therapist, a psychologist, a psychiatrist. And so I appreciate you for saying that. Who are we bringing on?
Look what she's
She's
wearing.
got our Kennedy Kid shirt on.
My dedication is that everyone that works in my house has to wear Kennedy Kids, and I didn't even tell her to do it. She did
Right.
it on her own today. Look at the back, the back.
Wow.
Look, the back, the back. Look.
Yeah. Yeah. That's the paint walk shirt. We
See?
appreciate you, Steve. We really appreciate you. But that's awesome, man. But I think again, just treating it like a disease, you couldn't have that was so important. Um, and it gives people, I think, and to me, it makes me feel even more at this stage, like it's even more important. How the level of importance, it's just not a mood. A disease is not a mood. A disease is something that is wrong with a particular part of your body. And so now, just listening to you say that, it makes me feel like, it's a sickness of the brain, and you have to treat it with a medication and therapy, and because all of that's a part of the brain.
Yeah.
Communication with a therapist and psychologist and psychiatrist and everything. Even more is almost, if you got a scratch on your arm, you use a cream and it fixes your skin, but you heal your skin. The brain is so much more complex. People need to take it a lot more serious.
Yeah, and I think it's important to understand, and I don't know what your thoughts are on this, but sometimes you have the long-term thing like a bipolar where yes, you're going to have to take a medication every day to manage that probably, right? I mean, I'm not the psychiatrist, but I guess that's what I've heard, right?
Right.
So, but I think also in terms of the acute stuff is that they can pop up again. So that was one thing that surprised me about mental health and mental health illnesses is that I used to think, because I had a very serious battle with depression when I was in high school. And I thought, okay, I did everything I need to do. I'm feeling better. that's it for that on my life, right? And
Right.
that couldn't be further from the truth, because there's been points in my life again where I've had to where I've re-experienced things, or I've had to deal with anxiety, or and different things have come up. So it's been although it's not something that I have to, obviously take medicine for every day, or that I deal with necessarily every day, it does kind of like pop up here and there. And I think the tools are really helpful for managing that. But I think it's something, I don't know your thoughts on that, because again, this is my personal experience, is that I was really surprised that it wasn't sort of like a one and done thing, because trauma or whatever can just surprise you and re-pop up, and you're like, oh wait, they say the body keeps the score, right? That very famous book. So it's like all of a sudden your nervous system starts to react, and your brain is falling back on old patterns, um and you're just defaulting to these things, versus, and then you're kind of taken by surprise by this, like, oh, I thought I was done with this.
Right.
Yeah, I don't think anyone is ever done with, things in life that may affect you, right?
Right. You're
May
never done with it. I agree with you. You're
I
never.
think, again, I think you wake up every day, and I know when I wake up every day, you know, there's triggers, right? There's things that could happen, and you learn as you get older, how to cope with some of those triggers maybe better than when you were younger. So I'm much better at coping with certain triggers. Like I used to get upset, let's say, quicker with my employees when they made a mistake. Now I've learned to cope with that and be more supportive and less, and I've even learned that playing sports with Robert, that the best way for us to perform is by me picking him up, or
Right.
him picking me up, instead of me saying, man, that was a shitty shot, or him looking at me and saying, what were
Yeah.
you thinking? And I'm looking at him and I go, I was not thinking about anything but maybe going out to dinner after the game.
Yeah.
You
We've gotten a lot better.
Yeah, because we've learned to cope. So the take home message is, you learn, how to cope. You also learn how to read other people and how to bring out the best in other people, your family, your friends, and it's a, life is, you know, they say that with young kids that their frontal brain doesn't really get fully to develop till they're probably in their mid-20s. So they make these bad decisions in their early 20s, and you sit there, and we sit there as adults and saying, how could this person not see that this is a bad decision? But it's just because they really haven't developed the coping skills and the knowledge to make a good decision, so
Right.
yeah.
Right.
And I think that that's really important too. I think one of the things to talk about the pressures and the incredible amount of things that today's teens are dealing with is the age-old truth that you build resilience the older that you get, because it's because the matter of the fact is that you have gone through more hard times, right? And you've learned how to oh wait, I'm going to overcome this. This is really not going to be the end of the world, and maybe it really sucks right now, but I'll find a way through this and it'll be okay again, right? And so when you're younger, you don't necessarily have that experience level where you're able to self-regulate chemically, but also just through knowing and maturity of experience of life.
Yeah.
100%. 100%.
What do we call it? We call it the young and dumb phenomenon.
Yeah.
Yeah. Terry
Right?
Crews called it teen brain on our
Teen brain.
called it
Right.
teen brain.
Like we all want to be young, but we definitely don't want to be dumb.
Right.
Yeah.
100%.
Yeah. Yeah, that part I wouldn't trade. There's things I'd go back to being young, but not that.
Exactly.
So
Yeah.
Steve, we're coming to the end, and we are gonna always ask. We got one question we always ask our guests before letting them go: is what three tools do you use? And you may have mentioned a few earlier, but what three tools do you use to really help you with your mental health?
Well, we
Give
discussed.
three things.
Yeah.
We talked about sports.
Yeah. I mean, you and I have gone over. I mean, we discussed them already. I mean, one is obviously exercise.
Right. What's two
Two,
more?
Yeah, so me, exercise. I think diet is super important for mental health.
Oh,
Um, and then the third thing for me is having a very tight circle of friends. So I wake up
right.
in the morning and Robert knows it because he's in my circle. There's probably 5 or 6 people that get the same text every morning.
Yo,
Right, yo, and then they text me back, and so we all talk about what are we going to do during the
yeah,
day to be happy, and how are we going to be happy together. So I
yeah,
think that tight circle of people that are always positive, and the exercise, and eating right and staying healthy, and I think those three things drives me, during the day, and it keeps me, pretty much at a 7.
okay, good. That's
I
good. Well,
love that.
Steve,
And I love the idea too. I think we've done this in our our Kennedy Kids group chat a couple times. Every once in a while, we'll pop in and be like, how's everyone doing scale of 1 to 10, right? Because you kind of like, you want to check in on people. And I think I love the point that you made earlier about the scale, because I think it's just an easy way for people
Yep.
to say, okay, I'm here, I'm there, right? And we can all relate to numbers, right? It's pretty simple. So
No,
how
it's
can people, go
really,
ahead.
yeah, I call my daughter in the morning, Samantha, and I'm like, Samantha, what are we at this morning? And she's like, oh, I had a great date last night, Dad. I'm at a 9. I'm like, good.
awesome.
Well, that's awesome. Yeah, I love that. And I think it's easy. That's an easy way for someone to say, I'm doing well or I'm not doing well. Because some people, maybe
Yeah,
it's harder to say, I'm not doing well, but you could say, I'm like a freaking 3 today. It's not going so well.
Yeah, and
right.
then day 3, what I do is I say, all right, Sammy, you feel 3. What are we gonna do to get it to a 7
Oh, I
today?
love it.
You want that foot massage? What do you want? What's going to get the 7? And she'll say to me, unfortunately, can we go to Chanel? And I go, well, that's going to bring you to a 7 and then me to a 3. Or I
Right.
text Robert a picture of a watch I want, and Robert goes, Steve, that ain't going to get you to a 9.
Maybe temporarily.
May get you to a 9 for one day, and
Yeah,
then
for
you'll be
one day.
right
And
back where
Robert
you
will go,
started.
don't do it. Don't do it.
Don't do it.
Then I don't do it, and I say, I feel pretty good not doing it.
Oh my God, that's so funny. I love it. So tell us, how can people find out more about you, connect with you, connect with Lynx Advisory, Lynx Medical?
Yeah, just go to lynxhealthadvisors.com or Lynx Medical, LYNX medical.com. And they can learn all about what I do.
I love
Awesome.
it. Well, I
Awesome.
certainly I'm going to go check that out myself, learn a little bit more about what you guys are doing. And I appreciate your
Yeah,
time
great.
today. As a reminder, if you are struggling with mental health, there is the 988 Crisis Prevention Suicide Line or just Crisis Prevention Line. It is completely confidential and it is free. There's also the Kennedy Kids Foundation website. Visit kennedykids.org. We have a bunch of resources for you there. You can also keep up on different events and things that we have going on. And of course, if you are in an absolute emergency, dial 911. It's never too late. Make sure that you are using the tools that are out there and always choosing life, guys. Just always choose life. I think that's one of the things that
Lose
we'll take
life.
home. Always. So want to thank you again for being here today, Dr. Schnur, and we'll hope to speak with you again real soon, and definitely see you at a Kennedy Kids event.
All right. All right. I'll see you later, Robert.
All right, guys. Later, Dr. Schnur.
Gotta weather the storm, gotta get mine. Gotta weather the storm, gotta